CPAP specifically can be helpful. You put a CPAP freaking 15 liters per minute if they're conscious and they're able to breathe. If you find that they're not, you're gonna have to bag them yourself. Okay. All right. Besides that,
A blanket.
yeah, okay. I mean, rapid transport, get them somewhere because albuterol ain't gonna help them with dick. They don't
I'm
have
telling
any
you, everybody
kind of
getting a blanket.
bronchoconstriction or anything like that. And even if they did, it's not gonna be able to expand the way you want it to. Right? Chronic bronchitis is basically you getting an upper respiratory infection. Like, I believe the timelines for it are 2 episodes are chronic within 1 year, right?
Yes.
Is that the one coughing for 3 months for 2 consecutive years or something like that?
Yes.
And they're coughing for like about 3 months in a row, one constantly, and they're heavy set too.
So it's three months of what?
3 months of consecutive coughing.
Yep.
For 2 years.
And
For 2 years. Mm-hmm.
Okay.
2 years.
Good
So,
question.
your big, yes.
You said it's an upper airway infection?
Well, it's it can produce signs of an upper airway infection.
Well, is it?
Like
It's
it
gonna
can
be low.
cause
It's gonna
It
it.
takes place
yeah.
in bronchi,
It
right?
takes place in the bronchi. It is going to be systemic in
Gotcha.
lower respiratory,
Okay.
but it will
Show signs.
unless you know, like someone tells you like there's going to be chronic bronchitis, you're going to walk in there and have difficulty breathing, and you're going to be like, okay, it seems like you might have an upper respiratory infection. But what's the difference is the same thing with an upper respiratory infection. It can go down.
Gotcha. Okay.
All right. Smoking. This is the primary sign, chronic bronchitis for females. Female smokers. Female smokers will get chronic bronchitis. Male smokers will more than likely have emphysema.
Okay.
Right? Smoking, and it's and basically what it is that smoking causes inflammation, causes your body to overcompensate and attempt to reduce friction on your lungs, which causes that production of mucus. Right? And that's from pretty much your own bad choices. Bronchitis over the whole thing can be caused by an infection too. So
It says it over here that it's respiratory distress from the overload from the heart too.
Hmm?
What?
no, just let me read it. I'm not like
I wrote that right here.
Now, mind you, I ain't finished the boards. I might be missing some stuff.
So,
Speak about that. Seems like you got everything else. You said that too.
Mm-hmm.
Yeah. The other ones.
All of them. I got you.
Appreciate it.
I'm fucking around. I might just post these in a group chat.
respiratory distress from
That was-
overload from heart.
Okay, yeah, no, I got you. Okay, so what he's talking about is since there's not a problem with the capillary beds and since it's a product of airflow not getting down, y'all know that there's dead space whenever you inhale, right?
Mhm.
Like you're not getting, not all the oxygen is getting down into the, well, not all the air is getting down
To the alveoli.
processing the
It's
oxygen.
like 150, right?
Yeah. So what happens is you increase blood flow to your lungs to attempt to retain as much of that oxygen as possible. Since there's not a whole lot getting through all that mucus and all that clogging congestionness,
Mm-hmm.
you're attempting to get what you get down there. You're attempting to pull as much oxygen out of it as possible. Right. So productive cough and prominent cough are going to be your thing. I believe this with chronic bronchitis, it can be productive or non-productive.
What do you mean unproductive and non-productive?
So coughing up mucus. So when
Okay.
when you
Producing
have
something.
when you got a cold, right, and you cough some shit up, comes out green, right?
Yeah.
Because the common cold is a viral infection, green sputum or green mucus cough up.
Vigorous coughing. That's
Yeah.
all upset with that.
All right. The difference between emphysema and chronic bronchitis, these guys are blue bloaters,
Yeah.
fat guys.
Emphysema is pink puffers.
Yep, pink puffers. But fat guys who are blue and cyanotic because they're not getting enough because they don't move around enough and they always sick all the damn time. You got freaking hand flapping, all right? I can't breathe. Help me. That's all it is. And then chronic cyanotic, we got that. And then they're not going to have the largest amount of difficulty breathing. Emphysema, it's going to be rough. They're going to be having a really hard time breathing. Chronic bronchitis, not so much. They're
Can
gonna,
you demonstrate the differences?
Emphysema?
No, I'm talking about breathing. The difficulty breathing.
Well, like he says, mostly males who are suffering
No,
from
I want you to
that.
demonstrate.
okay, yeah, I don't have time for this. We're continuing on.
Okay,
Right?
like this, right? Earlier.
There's not really a huge age group that's going to be for chronic bronchitis. Mostly because you can get bronchitis no matter what. But smokers are susceptible. Anyone who's got bad habits that help deteriorate lung tissue, they're going to be at risk. Medication and treatment. Go to this fucking.
No, we go back to the brown.
Oh, the blue. The blue is working pretty good. Go to. Meter-dose inhaler, bronchodilator. Yep.
And SBN for the
Yeah, small volume.
Albuterol, whether that be MDI or small volume nebulizer. Include in this
And you fucked the blue one, that thing was working great.